After your baby is born, whether you have a hospital birth or an out-of-hospital birth, your provider will check in on you. If you birth with a midwife out of hospital, she'll stay with you after the baby is born, usually for a few hours, to make sure that you and your baby are acclimating and bonding and healing. Hospital births, if you have a vaginal delivery, you most likely will stay anywhere from 12 to 48 hours. If you have a cesarean birth, you will stay in the hospital from 2 to 3 nights. When you get discharged to go home from the hospital, your provider must discharge you, the mother, and the pediatrician will discharge your baby. Sometimes mom gets discharged before baby is ready to be discharged, but you both must be discharged separately. Before you go home from the hospital, they will do a hearing test on your baby. Just know I have seen babies fail the hearing test, mainly because they might get some vernix lodged in their ear canal. The vernix is a protective coating found in utero, and sometimes when they're born, it can get lodged in their ear canal. So if your baby happens to fail the hearing test, it's not always the end of the world. You would just repeat it at your 1-week pediatrician visit. Around 24 hours, they do something called a PKU test or a heel prick, where yes, they do prick your baby's heel and they test your baby for very rare genetic diseases like sickle cell anemia. They're also checking to see if your baby can't digest breast milk. 1 in every 10,000 babies is not able to digest breast milk. You would want to know immediately if that happens to be your child, because that will change how you feed your baby. You usually get your PKU results back within a few hours to a day. And if you're having an out-of-hospital birth, your midwife might be able to do the PKU test, or you would do it with your pediatrician. Now, jaundice sometimes happens after the baby is born, and you'll see it because somewhere on your baby's body, whether it's their face or their arms or their chest, it might have a yellowing of their skin. A jaundice is a buildup of bilirubin in their body, which ends up making them very lethargic. It also consequently makes them not the best feeders because they're exhausted all the time. So the easiest way to clear the jaundice out of their system is to put your baby in indirect sunlight, or you can offer the baby your breast or a bottle, which will help eliminate the jaundice through pooping and peeing. A couple things to note about your newborn: whether you have a boy or a girl, the sex organs tend to be swollen. So in baby boys, their testicles are swollen. Baby girls, after they're born, their vulva is swollen and a small amount of bleeding might happen. And that is due to her hormones regulating for the first time apart from yours. So if you happen to be diapering her and you notice that, don't be worried, don't be alarmed. That is normal. If you're planning to circumcise, you can do that in the hospital. You can also talk to your pediatrician and see if they do that or if they can recommend someone that does. Not every pediatrician offers circumcision anymore, so just check with your pediatrician if they're willing to do it. You will go see your pediatrician sometime in that first week of life. I generally recommend giving yourself a couple of days. Some pediatricians offer special services where they come over to your house, and honestly, I think that is such a great thing to do for that first pediatrician visit. Midwives will continually check in on you over the course of several days, which is a very nice way to have that continuity of care, to make sure you're healing, that there's not too much bleeding. Midwives can help make sure that breastfeeding is going well. If you're having a hospital birth, they offer lactation support with nurses, but not every nurse has skills and education in lactation, so just be mindful that you might get advice from a nurse on lactation that might not be super resonant with your experience. The first week of life, everyone is really watching and concerned to make sure that the baby is gaining weight. And this might be a steady process. It might happen over the course of several weeks. So just be patient and continue to offer the breast or supplement with a bottle, or formula feed. I always tell my clients, feed your baby with love. It doesn't matter how you feed them, just feed them with love. You can expect that first week of life to be a bit of a wild ride. It's trial and error. Yes, your sleep might be affected by it for a little while. There are technology devices that claim to allow you to sleep longer or to get your baby to sleep longer. And I would really caution that, because biologically speaking, it is neurologically and evolutionarily important for babies to wake up every 3 to 4 hours in the newborn stage. If you want to encourage your baby to start to understand nighttime and daytime, you can walk at sunrise and sunset. When you and your baby are in sunrise light, your body starts producing adrenaline to give you energy to start your day. When you are outside in sunset light, your body starts to produce melatonin, which will help you wind down and to sleep better at night. I just want to stress that it is normal and biologically appropriate for babies to wake up all the time, daytime, nighttime. That is normal. They don't have a set circadian rhythm. Anytime you hold your baby, you are actually not only bonding with them, but you're helping your baby regulate their heartbeat and their body temperature. So for that reason, you cannot spoil a newborn by holding them too much. Some things to keep in mind for mom as she's healing from birth: pay attention to how much you are bleeding. Whatever level of bleeding you are at after delivery, we don't want it to increase. And what I see oftentimes, especially with my moms that have successful vaginal deliveries, is they get a second wind of energy because they're high from meeting their baby and excited to be done with birth, that they get up and they're moving around too much and it causes more bleeding. So you want to make sure that you don't soak through more than one large maxi pad in a 30-minute period. If you're soaking through that large of a maxi pad in 30 minutes, you're going to want to call your doctor. You might also pass some clotted blood. It shouldn't be like huge pieces, but you might see some little stringy bits or smaller clots, and it's usually okay. If you're at home and you have stairs, I highly recommend avoiding stairs for at least the first week after you give birth. That means someone is bringing you your food into bed. That means you are really limiting your mobility in order to heal your body. You're gonna know if you're doing too much because you'll start bleeding more. So you need to go slow in order to heal faster so that you can resume daily activities. There's also techniques like belly binding. Belly binding works for some and doesn't work for others. So you just need to figure out if it feels good to you, if you like something on your belly hugging you, giving you a sense of structure, helping with posture. It could be supportive. If you're someone that doesn't like to feel restriction or to feel a tightness around your abdomen, it might not feel great to you. There's also an incredible offering called the Closing of the Bones ceremony, and there are some amazing birth workers that offer that. It's a lovely ceremony that marks the end of pregnancy and birth and allows the mom to feel supported, closing out that time in pregnancy. A lot of people assume that you have a baby and there's just this instant bond and connection. And that might be true for someone, but not for everyone. So if you're someone that has given birth and you just didn't feel that instant connection to your baby, it's okay. Sometimes it takes time, and there's nothing wrong with you. As you come down from your birth experience, your hormones might be all over the place. If you feel really, really depressed and really, really anxious to the point where you can't perform any daily functions, you can't even use the restroom or take a shower or eat, these are signs that you need to call your provider. To help with healing, I recommend wearing socks after delivery. Some people cover their head so that they don't lose any more heat, that they can keep the body nice and warm things tend to create an environment that's conducive with healing, which means limiting cold and icy foods and beverages is really necessary for healing. It doesn't mean you can never enjoy something cold again. It just means really, really try and limit the ice cold things that you're consuming. Make sure you continue to replenish your body with healthy fats, a fair amount of protein, butter, ghee, coconut oil. These are all like glue that will help stick you back together. You can make warm stews or soups or casseroles. All of these are lovely, supportive things to consume in postpartum. You can absolutely try a sitz bath. Those can be very supportive to the tissues along the perineum. Sitz baths are readily available online and at supermarkets. They're fairly easy to find. A good lactation consultant can be very helpful in the early days of postpartum, and so is a doula. A doula can absolutely support you as you figure out breastfeeding. There are certain chiropractors that can help with newborns, especially if they're having trouble latching at the breast. So definitely look into chiropractic adjustments. They're very, very gentle with newborns, and I've seen it make a world of difference, especially on babies that have a relatively bumpy delivery. You're gonna know if there's a tongue tie or a lip tie because breastfeeding might be very painful. I just wanna highlight that cracked, bleeding, and sore nipples are the signs that you should look out for that would indicate that you need to really work with a good lactation consultant, a good postpartum doula, or talk to your pediatrician to see if they can help you perfect your latch. If you don't have any of these signs and breastfeeding is going seemingly well and you don't have too much pain, then you're doing great. Keep doing what you're doing. When you're breastfeeding, if you feel a sense of fullness all the time, your breast feels super hot or inflamed, use hot or cold compresses. You can also get in the shower, hand express in the shower, releasing some of the milk so that the milk moves through your ducts. That will help with the inflammation. We just don't want the milk to stagnate inside of your breast without being removed through extraction. It can lead to engorgement and also the breast infection mastitis. Most of my clients experience this hormone high after the baby comes that can last anywhere from 1 to 3 days. And then after that, usually the new mom will crash. She's tired, she's exhausted, she's feeding constantly, she's waking up a lot. There's a lot of demands here. So slowing down, making sure that you have a partner or other support people in place that can help you through those early days of postpartum is really essential. Anyone that's going to come into your home in those early days or weeks in postpartum, they need to be a neutral presence. If you feel like you're going to have to host or cater to someone in those early weeks just to have them meet your baby, I recommend delaying that meeting. You could put a sign on your door that says, "Welcome to our home. Here's our baby's name. Here's what time they were born. Upon entering our home, please wash your hands immediately." Maybe on that note, you put all visits need to be 30 minutes or however much time you deem as a necessary time frame for a visit. So just laying out ground rules can be a really good way to help others support you. Generally, I recommend to my clients to wait at least 1 week before they accept visitors coming over to their home. This gives you time to bond with your baby and your partner, and it's time that you never get back. So it's a really special time. Most women I have supported have told me that postpartum lasts way longer than 40 days or 6 weeks. I would say on average, the postpartum period is anywhere from 6 months to a year after you give birth before you really start settling into your body again. And the truth is, you're postpartum for life. Many clients decide to work with a pelvic floor therapist after they give birth, especially as they resume sexual activity, because things might not feel the same. In fact, most of the time I hear from clients, things feel very different than how they felt prior to having a baby. So a pelvic floor specialist can really help you bring awareness to your pelvis, give you certain exercises to make you feel a little bit more comfortable with that part of your body again. I think finding community after you give birth is so key in feeling good about your experience and having someone to talk to that is in a similar life stage as you. You can go to a Mommy and Me yoga group. You can hang out at the park and meet other moms. I just think the willingness to connect with other moms in person can be so supportive. I also think as a new mom, there's such a learning curve with asking for help and also receiving help. This is the beauty of being a new mother, is feeling supported by friends and family and allowing them to help you. So accepting support and help is important.